Have you ever considered that a really simple, healthy activity, something like riding a bike or maybe going horseback riding, could actually trigger a severe cascading autoimmune skin reaction?
It sounds like a total medical contradiction, honestly.
Right. I mean, you are out there getting fresh air, doing something objectively great for your cardiovascular system, strengthening your muscles.
Mhm.
And then your body's immune system just decides to hit the ultimate panic button in response to a bicycle saddle.
Yeah, it completely flips our standard understanding of exercise on its head.
Yeah.
Because we're conditioned to associate physical activity with reducing inflammation, flushing out toxins, all that good stuff.
Exactly. You definitely don't expect it to cause a localized immune system meltdown.
No, not at
Right.
all. But when you dive into the medical literature on how compromised skin actually interacts with mechanical stress, the picture of human biology gets, well, it gets infinitely more complicated. And frankly, it's pretty fascinating.
Right. It really is. And that's exactly the mission for today's deep dive. We have this massive stack of dermatology resources, medical guidelines, patient care manuals sitting right here. And we are sorting through all of it to answer one highly specific question.
Right.
Can the local trauma or the physical friction from cycling or horseback riding actually trigger a lichen sclerosus flare-up?
In looking at the clinical data, I mean, the answer is just a resounding yes.
100%. The physical friction from these sports can absolutely set off this disease.
Mm.
But digging into the actual mechanisms behind why that happens, it completely changes how you view the relationship between everyday physical wear and tear and your own immune system.
Yeah, it's wild. But to really understand that mechanism, we first have to establish what is actually happening at a cellular level with this condition.
Right. Let's lay the groundwork.
So lichen sclerosus, which is often abbreviated as LS in the medical charts, is a chronic inflammatory autoimmune dermatosis. But the most critical thing to understand right out of the gate is what this condition is not.
Yeah, the texts are actually incredibly strict about clearing up the lingering stigmas around this.
They really are. It is not an infection. It's not a fungus. It is definitely not a contagious pathogen that you can pass to a partner. And it is absolutely not caused by poor personal hygiene.
Which is such an important point. The guidelines are very protective of patients on that front, probably because, the physical presentation of the condition can look so alarming to someone who doesn't know what they're looking at.
Oh, for sure. It's essentially your own immune system just totally misfiring.
Yeah, the medical texts describe the affected areas as developing these porcelain white or ivory-colored patches.
Right.
And the skin itself undergoes this profound physical transformation. It becomes so incredibly thin, just entirely stripped of its natural elasticity.
Mm.
Dermatologists actually routinely compare the texture to crinkled cellophane paper.
Cellophane paper. I mean, that comparison perfectly captures the sheer fragility we're talking about here.
It's hard to even imagine skin getting that delicate.
Yeah, and when you look at the skin under a microscope, the immune system's T cells are just aggressively infiltrating the dermal epidermal junction.
They're attacking the basal layer, right?
Exactly. They are actively attacking the layer where new healthy skin cells are supposed to be born. And while they're doing that, they're simultaneously causing this abnormal rigid collagen to build up underneath.
So you basically have a surface that is paper thin and easily torn, sitting directly on top of a foundation that is stiff and scarred.
Precisely. And the demographics and the location of this condition are incredibly specific, too.
Yeah. In women who do make up the vast majority of diagnosed cases, the guidelines describe this classic figure of eight or hourglass pattern. So this porcelain white skin completely encompasses the vulva and the perianal area.
Though it's really vital to note here that the medical literature emphasizes this is not exclusively a female condition, and it's not strictly an adult one either.
Right, good point. The guidelines dedicate entire chapters to men and children. In men, it very often presents directly on the foreskin or the tip of the penis, the glands. Yeah.
And in children, particularly young prepubescent girls, the onset can just be devastating.
The pediatric guidelines actually include some very sobering warnings for doctors.
Mm-hmm.
The skin of a child with LS is so profoundly fragile that the tearing and the severe bruising caused just by normal movement?
Or even just scratching in their sleep.
Exactly, because the itching is so intense that scratching can easily mimic trauma. Medical professionals are actually trained to be extremely careful not to automatically misinterpret these lesions as signs of abuse.
Wow.
Obviously, they're required to rule that out, but it just illustrates how violently the skin breaks down.
Wait, okay, that brings up a glaring logical gap for me.
Okay, what is it?
If lichen sclerosus is fundamentally an internal genetic autoimmune issue, meaning, your own antibodies and T cells are internally programmed to attack your healthy skin cells, why would an external bicycle saddle matter at all?
Yeah.
Like, how does an internal immune misfire even know that you were sitting on a horse or riding a bike? That is the million-dollar question. And that gap between the internal immune system and the external physical world is bridged by a biological mechanism called the Koebner phenomenon.
The Koebner phenomenon. I saw that heavily referenced in the treatment manuals, especially in the sections about lifestyle modifications.
It's honestly one of the most fascinating concepts in modern dermatology. The Koebner phenomenon occurs when physical trauma to the skin, or even just persistent low-grade mechanical friction, actually initiates or worsens an autoimmune disease in that specific exact spot of the injury.
So the immune system is essentially drawn to an area of minor damage, but instead of just healing it normally, it completely overreacts.
Exactly. It triggers a full-blown disease flare-up right where the friction occurred.
It's almost like a hypersensitive building security system.
Okay, I like that analogy.
Yeah, so normally, if a window blows open in the wind, a security guard just walks over and shuts it. That's a normal body healing a tiny bruise from a bike saddle.
Right.
But with the Koebner phenomenon, the body's security system detects that exact same open window, panics, locks down the entire building, deploys steel shutters, and sets off the sprinkler system, just flooding the whole floor.
Yes.
It's a completely disproportionate, destructive response to a really minor disturbance.
That analogy is spot on because it highlights the hypervigilance of the immune response. The T cells see the microtrauma from the bicycle saddle and they mount this massive fiery defense that just destroys the local tissue.
And then you apply that to the biomechanics of cycling or horseback riding.
Oh, yeah. You are creating the ultimate perfect storm for this physiological phenomenon.
Because of the physics involved, really. You have direct, intense downward pressure from your body weight resting entirely on the perineum, which, happens to be the exact location where LS tends to localize.
And it's not just static pressure either.
No, it's a dynamic, repetitive, lateral shear force. Every single time you pedal a bike or post on a horse, you are creating friction. And then you add body heat and sweat into the mix, creating this highly moist, acidic environment that just further weakens the skin's protective lipid barrier.
The mechanical stress is quite literally acting as a homing beacon for the autoimmune disease. The friction signals the T cells to swarm that specific area.
Wow.
And the clinical sources actually expand on this to show a much broader everyday pattern. It's not just limited to intense sports like cycling and riding. Any mechanical trigger, any localized physical stress can initiate this Koebner response.
Like scratching. The sources mention scratching as a primary driver, which creates a horrific catch-22 for the patient.
The itch-scratch cycle in LS is notoriously brutal. The autoimmune inflammation causes intense sleep-disrupting itching. So the patient scratches the area, often unconsciously while they're sleeping.
And then the fingernails cause those microscopic tears in the epidermis.
Exactly. And that mechanical trauma triggers the Koebner phenomenon, which draws more immune cells to the area, causing more LS lesions, which in turn causes even more intense itching.
It's just a self-feeding loop of inflammation. But the guidelines also point to surprisingly mundane, everyday things that most people never think twice about.
Oh, absolutely.
Like wearing tight underwear, or the friction from thick clothing seams, like, the rigid inseam of heavy denim jeans rubbing as you walk, or even old surgical scars.
Yeah, surgical scars are a classic presentation. Because the tissue was previously traumatized by a scalpel, the local cellular environment is permanently altered.
So the immune system just remembers that trauma.
It remembers, and years later, lichen sclerosus can literally map itself perfectly along the line of an old appendectomy scar or an obstetric scar.
That is wild. There is also a highly specific mechanical trigger outlined for men that involves chemical trauma rather than just physical friction.
You're talking about the occlusion of urine.
Yes, exactly.
Right. In men, if a small amount of urine dribbles and gets physically trapped beneath the foreskin, it causes a chronic, intermittent chemical irritation. Urine contains urea, which breaks down into ammonia.
And that ammonia burns and damages the delicate epithelial tissue.
Precisely. The immune system perceives that chemical burn as localized trauma. And just like the friction from a bike saddle, it triggers the Koebner response. It can potentially initiate male genital lichen sclerosus right there on the glands.
So, okay, given all these triggers, from heavy denim to bicycle saddles to the body's own waste, What does this actually mean for someone's lifestyle?
Yeah, it's a big question.
If you're listening to this and you're a passionate cyclist or you've been riding horses your whole life, does an LS diagnosis mean you are just doomed to hang up your helmet forever? Because the mental and cardiovascular toll of giving up a beloved sport, that seems incredibly high.
It does, but the patient care manuals are very clear here. You do not have to quit forever,
Well, thank goodness.
but you are required to drastically change how you interact with your sport. You have to respect the skin's new biological boundaries. The absolute medical consensus is that during an active flare-up, when the skin is inflamed, cracking, or symptomatic, you have to pause the activity entirely.
So there is no such thing as pushing through the pain when dealing with the Koebner phenomenon.
Absolutely not. Pushing through the pain is just signaling your immune system to attack harder.
Right. So you pause until the topical treatments calm the inflammation down. And then, when you're ready to get back in the saddle, the sources outline highly specific biomechanical workarounds to modify the activity.
Yeah, the entire goal of modifying the gear is to mitigate that downward pressure and lateral mechanical stress.
So for cycling, what are we looking at?
The primary recommendation is swapping out standard, narrow bike seats for a much wider, padded saddle or even a noseless saddle. You are attempting to alter the geometry of how you sit, basically.
Distributing your body weight away from the delicate perineal tissues.
Exactly, and forcing the robust ischial tuberosities, your sit bones, to take the load instead.
And then clothing becomes a medical intervention at this point too, right?
Oh, a huge one.
The guides suggest heavily padded cycling underwear, but they include a massive caveat regarding the construction of those garments. You have to aggressively avoid any clothing with bulky seams in the crotch or the gusset.
Because if you have skin that is currently as thin as crinkled cellophane, a single thick reinforced thread running right down the middle of your shorts.
It's going to act like a microscopic saw blade over a 10-mile bike ride.
Exactly. It's a disaster waiting to happen. And preparation before the workout is treated with the exact same importance as the equipment itself.
Yeah, multiple clinical sources recommend the liberal application of a heavy, inert emollient, something as basic as pure petroleum jelly like Vaseline.
Used as a physical barrier cream.
Right, applying it directly to the skin before exercise.
It acts as an artificial lipid layer. It actively lubricates the tissue, drastically dropping the friction coefficient.
So it allows the skin to glide against the padded shorts rather than gripping and tearing.
Exactly.
Yeah.
It's the biological equivalent of packing a mechanical joint with grease so the metal gears don't grind each other down.
That makes so much sense.
Yeah.
And then the moment the workout is over, the clock starts ticking.
Oh, big time.
The advice is to strip off wet swimsuits, sweaty horseback riding breeches, damp gym clothes just immediately.
Oh.
Sitting around in a moist environment macerates the skin, making the barrier even weaker and more permeable to irritation.
Yeah, but the post-workout hygiene protocol is where human instinct completely clashes with medical necessity.
This part blew my mind. Because think about what you naturally want to do after a grueling, sweaty bike ride. You feel sticky, you might have some minor chafing, you just feel gross.
Right.
The absolute first instinct for almost everyone is to jump into a steaming hot shower, grab a loofah, and vigorously scrub the area with hot water and some sort of heavily scented antibacterial soap to feel clean and fresh.
And doing that to tissue affected by lichen sclerosus will trigger a massive catastrophic flare-up. The dermatological guidelines explicitly and universally forbid traditional soap and scrubbing.
I really want to dig into the why of that, because the guidelines are incredibly strict. They ban bubble baths, wet wipes, even the ones marketed as hypoallergenic or for sensitive skin.
Yeah, all of it.
Scented shower gels,
Yeah.
feminine hygiene washes. Why is a standard bar of soap so dangerous here?
It comes down to the chemistry of the skin barrier and the chemistry of the soap. Traditional soap relies on surfactants.
Right, surfactants.
Surfactants are molecules specifically designed to bind to oils and water simultaneously. That allows them to rip grease and dirt away from a surface and wash it down the drain. The problem is, healthy skin relies on a delicate, slightly acidic lipid barrier, the acid mantle, to protect the nerve endings and keep moisture in.
And the LS skin is already compromised. The immune system has already thinned it out and damaged that barrier.
So when you apply a harsh chemical surfactant to that cellophane-thin skin, you are violently stripping away whatever microscopic layer of protective oil was left. You're altering the pH of the skin, making it more alkaline, which breeds bacteria and yeast. And you are exposing raw, inflamed nerve endings directly to harsh chemical detergent.
And so the immune system detects all this chemical trauma and physical scrubbing,
Yeah,
and the Kubner phenomenon kicks into high gear.
exactly. It's a complete paradigm shift in how we define cleanliness.
So what's the alternative?
The clinical protocol is to wash incredibly gently with lukewarm water only. If you absolutely feel the need to use a cleanser, to remove that sweaty barrier cream you applied earlier, it must be a prescribed or pharmacist-recommended emollient soap substitute.
An emollient substitute is critical because it cleanses the skin without acting as a detergent. It removes the surface debris, but actually leaves a protective, moisturizing film behind on the tissue rather than stripping it bare.
Yes, and even the act of drying off requires a behavior change. You cannot take a towel and rub the skin dry.
Just the friction from a terry cloth towel is enough to trigger a flare.
Oh, absolutely. The guidelines suggest gently patting the area dry, or as many patient manuals recommend, using a handheld hairdryer on a cool setting.
To dry the moisture without any physical contact whatsoever.
Precisely. And then you immediately reapply a fresh layer of moisturizing barrier ointment.
The depth of these guidelines really highlights just how reactive this tissue becomes. Every single physical and chemical interaction with the skin has to be audited for friction and irritation potential.
Yeah, you really have to rethink everything.
I even saw a highly specific note in the patient guides regarding toilet paper.
Oh, yeah.
They suggest switching to unbleached bamboo or recycled paper to avoid the bleaching chemicals. Better yet, they recommend abandoning dry toilet paper entirely in favor of a Perry bottle.
Which is fantastic advice.
Yeah, it's a small squeeze bottle filled with warm water to gently rinse the area after using the bathroom. Wiping with dry, abrasive paper is just another form of daily mechanical friction.
It really is.
They also say absolutely no panty liners, as the adhesive chemicals and the rough surface texture are notorious everyday triggers.
It requires a profound level of mindfulness about your body's physical boundaries.
Which brings us to the ultimate long-term question. Why is this microscopic level of care so crucial?
Yeah.
What happens if a patient gets tired of the routine or they just really love cycling and they decide, you know what, it hurts, I get a rash, it's uncomfortable, but I'm tough. I'm just going to grit my teeth, push through the pain, and ignore the friction. Can they do permanent damage by ignoring this?
The short answer is yes. Devastating, permanent damage. If a patient ignores the friction and allows the autoimmune inflammation to run rampant, the disease progresses into a phase clinically known as sclerosis.
Sclerosus.
Sclerosis literally translates to scarring or hardening.
Yeah.
This is not just a superficial rash that flares up and fades away. The actual physical architecture of the body begins to irreversibly distort.
The details in the surgical and gynecological sources regarding sclerosis are truly sobering. Because the immune system is constantly attacking the tissue, the body's fibroblasts panic, right?
Right.
And they start overproducing rigid collagen in a desperate attempt to heal the constant damage. So the skin doesn't just get tight, it literally shrinks, loses all elasticity, and begins to fuse to itself.
It's horrific. In women, the anatomical changes can be profound. The labia minora, the inner lips, can physically shrink and resorb into the surrounding tissue, eventually disappearing entirely.
Wow.
The clitoral hood, which is normally pliable, can become stiff, thick, and completely scarred over.
That creates a condition called clitoral phimosis, right? Where the clitoris becomes physically trapped beneath the rigid scar tissue, which the medical texts note is incredibly painful and causes severe sexual dysfunction.
Yeah, and perhaps most significantly from a functional standpoint, the inflammation can cause the labia majora to fuse together across the midline.
Right, resulting in what the texts call introital stenosis.
Exactly. It's a severe physical narrowing of the vaginal opening. The tissue basically becomes a rigid, unyielding ring of scar tissue.
And in men, the equivalent architectural destruction is phimosis. The foreskin becomes so heavily scarred, thickened, and rigid that it physically cannot retract anymore. It acts like a fibrous tourniquet around the glands.
When you look at how these architectural changes impact the trajectory of a patient's life, it is devastating to their overall quality of life. The loss of elasticity, the narrowing, and the dense scarring lead directly to severe dyspareunia, which is the clinical term for excruciatingly painful sexual intercourse.
For many patients with advanced sclerosis, intimacy becomes physical impossible. It causes immensely painful erections in men.
And it impacts basic bodily functions, too.
Right.
The rigid scar tissue can cause urine to spray unpredictably. And because the perianal skin is so tight and fragile, simple bowel movements can cause the skin to physically tear open, making going to the bathroom an agonizing experience.
If the disease is allowed to progress to that stage of severe architectural change, simply swapping out a bike saddle or using a barrier cream is no longer sufficient.
No, not at all.
At that point, the first-line treatment, which is the diligent long-term application of ultra-high-dose topical corticosteroids to shut down those overactive immune cells, that can only do so much.
Right. The steroids can halt the inflammation and prevent further scarring, but they cannot reverse the structural fusing that has already occurred. If you reach that point, the medical guidelines indicate that major surgical intervention becomes the only viable option.
And the surgical resources detail some incredibly complex reconstructive procedures required to just restore basic anatomy. In women, this might involve a specialized vulvectomy to remove the severely diseased tissue, or careful surgical division of the fused labial adhesions to reopen the vaginal canal.
Yeah.
In men, a full circumcision is often required to surgically remove the strictured, tourniquet-like foreskin.
But there's a cruel irony to the surgical option, which circles right back to where we started today. Even if you undergo a complex surgery to remove the scar tissue, lichen sclerosus is still a chronic systemic autoimmune condition. And because of the Koebner phenomenon, the physical trauma of the surgeon's scalpel can actually trigger a massive recurrence of the disease directly inside the fresh surgical scars.
It really is a lifelong management process. Surgery is not a cure. It is a salvage operation for anatomy that has been lost to chronic inflammation.
Well said.
There is one final high-stakes consequence detailed in the literature that explains why you absolutely cannot ignore an untreated flare-up. It's statistically rare, but the risk is significant enough that it changes the entire protocol for how doctors monitor this disease.
The literature is very clear on the malignancy risk. Untreated chronic long-term inflammation from lichen sclerosus slightly increases a patient's risk of developing a specific aggressive type of skin cancer known as squamous cell carcinoma.
The risk sits at roughly 3 to 5% over a patient's lifetime, according to the clinical data. So on one hand, 95% of patients will never develop it. But a 5% risk of cancer is still high enough that lifelong clinical monitoring becomes absolutely mandatory.
Definitely. And to understand why that cancer risk exists, you just have to look at cellular biology. Chronic inflammation means the body is locked in a state of high cellular turnover. The immune system damages the tissue, and the body frantically tries to rebuild it by rapidly dividing new cells.
So over years and decades of this rapid chaotic cell division, the statistical likelihood of a DNA copying error just naturally increases.
Exactly. Eventually, one of those genetic mutations isn't caught by the body, and it develops into squamous cell carcinoma.
So using the steroid treatments and managing the friction isn't just about avoiding a painful rash or making a bike ride more comfortable. It's a vital, proactive form of cancer prevention.
It absolutely is. Patients are trained to perform regular self-examinations with a hand mirror, looking for very specific warning signs.
Like persistent ulcers that won't heal.
Right, or new hard lumps, or sudden unexplainable changes in the skin texture that no longer respond to their normal steroid ointments. Managing the mechanical triggers is truly the first line of defense in keeping the tissue calm and the cellular turnover low.
Let's pull all these threads together. We started by looking at a stack of clinical documents to answer whether the physical friction from a bike, saddle, or horseback riding could genuinely trigger an autoimmune flare-up. And the biomechanical reality is definitively yes.
Yes.
It is the perfect, albeit unfortunate, real-world example of the Koebner phenomenon in action. The microscopic mechanical stress and shear force localized on the perineum act as a beacon, signaling the immune system to launch a devastating, inappropriate attack on your own skin.
It bridges the physical world of mechanical engineering, the downward force and friction of a hard leather saddle, with the microscopic world of cellular biology and T-cell activation.
And the major takeaway for you listening is that this knowledge is a tool for empowerment. If you understand the biological why behind your skin's reaction, if you understand the hyper-vigilant security system of the Koebner phenomenon, You don't have to be at its mercy.
Right, exactly.
You or someone you love who is dealing with this can actively take back control of your lifestyle. You can modify the physics of your activity. You can invest in wider noseless saddles. You can use thick barrier creams to alter the friction coefficient.
And most importantly, you can adopt a skincare routine that protects your lipid barrier rather than violently stripping it away with hot water and harsh chemical surfactants.
Exactly. You don't have to suffer in silence, and with the right modifications, you don't necessarily have to give up the sports and activities that bring you joy.
It's entirely about understanding your body's new biological boundaries and actively working with them rather than fighting against them and causing further trauma. And, if we connect this highly specific, localized dermatological quirk to the much broader picture of human biology, it raises a truly profound question about how we interact with our environment.
How so?
Well, the Koebner phenomenon brilliantly illustrates a direct, physical, and undeniable link between outside mechanical friction and a massive internal immune system misfire.
Right, the immune system treating a bicycle saddle like a mortal enemy.
Exactly. It makes you wonder if our biology can overreact so aggressively to the friction of a bicycle seat or the seam of a pair of jeans. What other microscopic physical, chemical, or environmental stressors in our daily modern lives is the human immune system silently overreacting to? Are we violently mistaking everyday wear and tear for a full-blown existential threat?